I'm Ed Highland, and this is ASA TV, and I'm joined now by ASA Past President, Dr. Jane Fitch. Thank you so much for coming and joining us today.
You're very welcome.
Let's talk a little bit about the ongoing concern, the VA proposal to eliminate, which is what's been a long-standing policy of the VA, of providing physician, assisted care for our veterans.
Yes, Ed, this has been one of our major concerns in regards to patient safety since we found out about it almost 2 years ago. So, one of the main reasons that we're so concerned is we know from the literature that our veteran patients are 14 or 15 times sicker than the comparable Medicare age patient. We also know that there are tremendous differences in both education and training between nurse anesthetists and physician anesthesiologists. So for instance, my background as both a nurse anesthetist as well as now physician anesthesiologist, that's why I'm so concerned about the safety of our veteran patients with this proposal. Nurses do perhaps 4, 5, 6 years after high school, and physicians do probably 12 or 14 years. That really means a difference between 2,000 and 3,000 hours and 14,000 to 16,000 hours. When you look at what we do with providing anesthesia care, although it's safer than it's ever been, we still take you closer to death than you're ever going to go and bring you back again. And you can never be too well educated or too well trained to function in that environment. If you look at the education for the nurse anesthetist in terms of independent practice, there's really only one of the programs throughout the country that's in a state that even allows it. So we're concerned that they're not even getting education and training in that arena. We also have concerns from an education of our physician anesthesiology residents as well. The VAs are closely integrated with all of our academic medical centers, and the notion that you could on one single campus have different standards and different levels of care is very concerning from that educational standpoint. Since we found out about this, the ASA has really had a wide sweeping plan to be able to let the VA officials know of our concerns and to be able to reach out and meet with various physicians in leadership positions within the VA and groups of physicians within the VA. And then we've also reached out to our veteran service organizations because they have the most at stake. We have asked our veterans to put their life on the line for us once before, and we certainly don't want to ask them to do the same thing by eliminating their physician-led anesthesia care when they're having surgery or anesthesia within the VA. So a really important issue from our standpoint relative to patient safety and the health of our veterans who deserve the best.
What can ASA members do to make sure that their voice is heard in this?
ASA members have a critical role to play. We need every single solitary member who is at this meeting to come to one of these kiosks and send their response to the Federal Register in regards to their concerns for the safety of our veteran patients and the move that this would eliminate our physician-led care team. That served the VA well for over a decade with the existing anesthesia service handbook. And so by creating this nursing handbook and pulling the nurses out, the nurse anesthetists out of the anesthesia care team handbook, that's where we have our concerns. So we need to make sure that we maintain physician-led anesthesia care within the VA, and we need everyone's voice to be heard at the VA, and so that's why we're asking everyone to take a few minutes, visit a kiosk, register your concerns for patient safety, and we'll make sure it gets to the Federal Register for consideration.
Is this time sensitive? We need to do it now?
Absolutely, we need to do it now. The actual proposal has not been officially put in the Federal Register. We hear that it will be coming most any time now, and that's why we're gearing for the response. All of these responses that will be done here we'll be able to forward at the appropriate time once that comment window opens. We think it also will be a very short comment window, perhaps 30 days maybe. And now that we're entering into the holiday season, we really need people to be paying attention and being responsive to this call for letting folks know about our concerns for veterans and their safety for anesthesia and surgery care.
So it's a call to action for ASA members.
Absolutely. Never been a more important time for our members to let their voices be heard about the safety of our veterans and protecting their anesthesia care and surgery care at the VA.
Dr. Jane Fitch, thank you so much for joining us.
You're very welcome.
This is ASA TV.